Dr. Bob, can you please tell us what has changed since our last interview? We did an interview at the 35-year anniversary of AIDS. Now we're 40 years. What has changed?
We have continued to see development of newer drugs that are more efficacious and easier to take. We're now into a treatment period where no one ever thought we would be, and that is we have an injectable that can be taken every 28 days, and that eliminates any other HIV medication. It's a total regimen in itself. We have drug combinations that are only 2 drugs, where we thought we would never use any less than 3. The death rate in terms of what we're seeing, unfortunately, has remained relatively stable. We have not seen a dramatic change in the death rates, and we're beginning to see upticks in new cases being diagnosed. So part of the death rate has to do with the fact that the population has aged. We now have people in their 60s and 70s, where early on it was all people in their 30s and 40s. So most people who die today don't die from AIDS. They die with AIDS, but they don't die from it. There are heart attacks, colon cancer, lung cancer, you name it. Any medical health issue that could have come, we're now seeing as cause of death in most of our patients with HIV. The statistics, particularly for the state of Florida, show that we have the highest incidence of any state in the country now. And a lot of that has to do with the fact that so many people are moving in to Florida and they get counted as new cases. For the young population, PrEP has made a difference when we're seeing the pre-exposure prophylaxis programs are really picking up. During the pandemic of COVID, it really dropped off. We weren't seeing people, and I just met with one of the other representatives this week who says their PrEP prescriptions are just flying off the shelf, that there are so many people now getting into PrEP. A lot of it has to do with the fact that people are now active on the internet again. With the pandemic, so many people got afraid. They were more afraid of the pandemic than they were HIV.
If I'm single who has HIV and meets somebody and I'm not detected, do I need to ask him to take PrEP?
That's a question that becomes an individual question. The important thing that we know, the campaign called U equals U, or undetectable equals untransmissible, is real. Once the viral load stays below 200 copies, that person will not pass the virus on to their partner. The example that I always use for people who are in monogamous relationships with a partner who's positive, as long as you're confident that he or she is taking the medicine every single day and not allowing blips of viral activity in the system, that person should be safe, and that PrEP is an option. It's a choice.
Recent statistic that people with HIV might be less infected by COVID because of the protection that already their viral medications are providing. Is that true?
There is some data that shows that people who are on antiviral medications have a shorter or less severe course. There was a study done in Spain. It didn't show a statistical difference between those who were HIV positive and those who were not, but there was a trend showing that the patients did not get as ill. In my practice, we took 100 patients who were HIV positive or on PrEP, and what we found in our patients that were on PrEP and on HIV medication, we didn't have any deaths in that group. We had about 8 or 9 who got infected, but they didn't end up in the hospital. Compared to our HIV negative group, we had 3 deaths in that population. We had a number of people get infected, and I'm not counting this as a scientific study or something that we should hang our hat on and say this is true data. This is just an observation that was done just in one clinic.
Another interesting statistic that I find amazing is that my understanding is about 92% of the gay community has been vaccinated. Are you aware of any of those information?
I'm not aware of that number, but I'm not surprised. We're finding that many HIV providers are pro-vaccine, and so you're going to find that those, particularly with HIV, we have nearly all of our patients vaccinated at this point in time. But I think the gay population is, in general, a more educated population. I can't state that as a fact, but it just seems to be a trend that most of our gay patients have higher education. They're a little more open to suggestion when it comes to scientific fact, as opposed to getting involved politically and making this a political issue rather than a science issue.
Right, and when AIDS was on, there was some political issues, but it was more of discriminating among those who got it. And this time is a different political impact on don't wear a mask, don't do this. They're afraid of the treatments and the prevention and not about the people that are getting it.
Yeah.
The gay community went through a lot of discrimination politically for that. We are very aware that it's important to follow the facts and follow the science, because we were not responsible for the AIDS, but we were the victims.
Well, especially early on in the AIDS epidemic, there was a lot of blame, a lot of finger pointing, and it was being blamed on the gay community, and it still represents the highest population in the HIV population is homosexual transmission. So we didn't see the type of political interference that occurred during the beginning of the epidemic came all the way from the president. Ronald Reagan never mentioned the word AIDS and wouldn't talk about it. And it was one of those times where the conservatives were in control, and it was felt that this was a disease that was going to wipe out the undesirables, particularly the gay population, and nothing was done. It just, we had spreading of this virus for 4 to 6 years before our government started paying attention. They used to call it the 4-H disease, and that was homosexuals, hookers, heroin addicts, and Haitians. And it wasn't until that 5th H appeared, which was Ryan White, who was a hemophiliac, that the government started to look and say, hey, guess what? This is in the blood supply. We need to do something. So that wasn't until after 1985.
And now that you're also specialized on hepatitis C, what is the incidence among gay people? Because being it's also a blood transmitted disease, and many times it's not even detectable.
Right. I haven't seen it just on gay people alone, but we do know our HIV patient population, about 40% of those are co-infected with hepatitis C. The great thing about that is we can cure people within 8 weeks. The side effect profile is pretty much a zero. We just don't have significant side effects. We've cured over 2,700 people. Of our HIV population, which only accounts for about 400 patients, we had about 10 or 12 that were co-infected, and they got treated as soon as these drugs became available. The hepatitis C virus is something that is passed from blood to blood transmission. Something to consider, which a lot of people don't, is snorting drugs with other people is a risk. If people share a straw, they've gotten the blood encapsulated from the nose of every person who passed that straw around. So you're exposing yourself to the blood of every person in that room. What we know from a tattoo standpoint, that the virus can survive in ink, and it can survive in a closed syringe for up to 63 days. So people that think they've cleaned their works or they've gotten a new needle, they've missed the boat. We need to know that the ink is fresh and clean, and we need to know that works are being thrown away. Another big push for needle exchange programs.